Before we talk about exercises, let me ask you to imagine something quietly powerful. Imagine the journey of a single drop of blood traveling from your heart all the way down to your toes. It moves without sound, without applause, carrying oxygen, nutrients, healing signals, and life itself. Most days we never notice this journey, but for someone living with diabetes, that journey can become slow, fragile, even interrupted. And when circulation weakens, the feet are often the first to suffer, not because they are unimportant, but because they are farthest from the heart. This is where understanding, movement, and compassion come together. The human body was designed for motion, not intensity, not punishment, but gentle, consistent movement. From a scientific perspective, circulation improves when muscles contract and relax rhythmically. Each contraction acts like a secondary pump, helping veins push blood back toward the heart. Doctors often explain this in simple terms: when muscles move, blood moves. When muscles stay still for long periods, blood pools, oxygen delivery drops, and tissues slowly lose their ability to repair themselves. In diabetes, where blood vessels are already under stress from high glucose levels, this lack of movement quietly accelerates damage, especially in the feet. When physicians talk about preventing diabetic foot problems, they rarely start with dramatic interventions. They start with awareness and small actions. Gentle foot and ankle exercises increase blood flow by stimulating tiny capillaries that feed the skin, nerves, and connective tissue. Over time, better circulation means warmer feet, healthier skin, improved sensation, and faster healing of minor cuts. This is not theory, it's physiology unfolding in real time. Doctors often remind patients that the goal is not athletic performance, but biological cooperation with the body's natural repair systems. There is also something deeply human about this process. As circulation improves, nerves receive more oxygen and nutrients. This can help slow the progression of numbness and tingling that many people with diabetes experience. Neurologists explain that nerves are living tissues with metabolic needs. When blood flow improves, nerves function better, sending clearer signals to the brain. This is why simple movements like ankle rotations, toe flexing, and calf activation can feel almost meditative. They are quiet conversations between the nervous system and the bloodstream, restoring communication that diabetes tries to disrupt. From an endocrine perspective, movement also influences blood sugar itself. Even low-intensity exercises increase insulin sensitivity in muscle cells. Doctors describe this as muscles opening their doors wider to glucose, allowing sugar to leave the bloodstream and enter cells where it can be used for energy. This reduces the burden on blood vessels and lowers inflammation, both of which are critical for foot health. In this way, circulation and glucose control are not separate goals. They are deeply connected biological processes supporting one another. What often goes unspoken is the emotional side of diabetic foot care. Fear of ulcers, infections, or amputations can create anxiety, and anxiety leads to avoidance. Yet movement, when approached gently and consistently, becomes a form of reassurance. It tells the body, "I am paying attention." Many doctors emphasize that these exercises are not just physical therapy, they are acts of self-respect. Each controlled movement sends blood, warmth, and healing signals into areas that feel forgotten. Over time, this builds trust between a person and their body again. Scientifically, consistency matters more than intensity. Circulatory adaptations occur gradually as blood vessels respond to repeated demand. Endothelial cells lining the arteries become more responsive, vessels dilate more easily, and oxygen delivery improves. This is how prevention works quietly, daily, without drama. Physicians often say that the best exercise for diabetic foot health is the one you can repeat every day without pain or fear. In that repetition, the body relearns balance, stability, and resilience. And perhaps the most profound insight is this: improving circulation is not about fighting the body, but supporting it. The feet carry the weight of a lifetime, yet they ask for so little in return. A few minutes of intentional movement can change blood flow, nerve health, skin integrity, and confidence. In the language of medicine, we call this prevention. In the language of humanity, we call it care. When we talk about gentle foot and ankle exercises acting as natural pumps, we are really talking about how the body was designed to help itself when it is given even the smallest chance to move. Blood does not flow through the body only because the heart pushes it forward. The heart is powerful, but it relies on cooperation. In the lower legs and feet, gravity is always working against circulation, and this is where muscle movement becomes essential. Every time the ankle bends, every time the toes curl or spread, the surrounding muscles squeeze the veins gently, pushing blood upward. back toward the heart, and making room for fresh, oxygen-rich blood to arrive. This simple mechanical action is one of the most underestimated tools in preventive health. Doctors often explain this to patients by saying that muscles are like assistants to the heart. In the feet and calves, where blood has the longest distance to travel, this assistance becomes critical. Without movement, blood can stagnate, oxygen delivery slows, and tissues begin to suffer quietly. In people with diabetes, this process is even more fragile because high blood sugar can damage the lining of blood vessels over time, making them less elastic and more prone to narrowing. Gentle exercises do not force these vessels to work harder than they can handle. Instead, they invite them to open gradually, responding to repeated, low-stress signals that say it is safe to deliver more blood. From a scientific perspective, this pumping action improves what doctors call venous return, but the deeper meaning lies in what happens at the smallest level. As blood flow improves, tiny capillaries in the feet receive more oxygen and nutrients. These capillaries are responsible for feeding the skin, nerves, and connective tissue. When they are well supplied, the skin stays healthier, small cracks heal faster, and the risk of infections decreases. This is why physicians emphasize foot movement even for people who cannot walk much. The goal is not distance or speed, but circulation itself. There is also an important neurological aspect. Movement stimulates sensory receptors in the feet and ankles, sending signals to the brain that help maintain nerve pathways. Doctors often note that when circulation improves, nerves receive more glucose and oxygen, which can slow the progression of numbness and tingling. The muscles and nerves begin to work together again, reminding the body how to maintain balance and awareness. This is especially meaningful for people who feel disconnected from their feet due to long-standing diabetes. Gentle exercises help restore that connection, one movement at a time. What makes these exercises powerful is their simplicity. Ankle circles, toe lifts, heel raises, and slow foot flexing require no equipment and very little space. Yet their effect on circulation is profound because they are sustainable. Medical professionals consistently highlight that the body responds best to repetition. Each small movement sends a signal through the vascular system, encouraging blood vessels to dilate slightly, improving endothelial function, and reducing stiffness. Over time, this repeated pumping action trains the circulatory system to respond more efficiently, even at rest. There is also a quiet emotional benefit that doctors may not always name, but patients feel deeply. When someone actively moves their feet with intention, fear begins to loosen its grip. Fear of ulcers, fear of wounds that will not heal, fear of losing independence. Gentle exercises replace fear with participation. They allow a person to feel involved in their own care rather than waiting for problems to appear. This sense of agency has real physiological effects, lowering stress hormones that otherwise constrict blood vessels and further impair circulation. Physicians often remind patients that circulation is not an on-off switch. It is a dynamic process influenced by posture, breathing, hydration, and movement. Gentle foot and ankle exercises fit naturally into this system because they can be done frequently throughout the day. Even a few minutes after sitting for long periods can prevent blood pooling and swelling. From a preventive medicine standpoint, this regular activation is far more protective than occasional intense activity that may cause strain or injury. At its core, using foot and ankle exercises as natural pumps is about respecting the body's design. The feet are not passive structures. They are active participants in circulation balance and overall metabolic health. When they move, blood moves, oxygen flows, and healing becomes more likely. This is why many doctors describe these exercises not as optional add-ons, but as foundational habits for anyone concerned about diabetic foot health. They are quiet, consistent signals to the body that life is still flowing, that tissues are still being nourished, and that prevention is already in motion. When circulation improves, the effects reach far beyond simple warmth in the feet. What is truly happening is a restoration of nourishment at the tissue level, where cells depend on a steady supply of oxygen, glucose, and immune support to survive and repair themselves. In diabetes, compromised circulation often means that the skin, nerves, and deeper structures of the foot are living on the edge of deprivation. Doctors often explain that poor blood flow does not cause problems overnight, but it creates an environment where even small injuries struggle to heal. Improving circulation changes that environment from one of vulnerability to one of resilience. From a medical standpoint, healthy circulation supports the skin's natural barrier function. The skin on the feet is constantly exposed to pressure, friction, and microtraumas from daily movement. When blood flow is reduced, the skin becomes dry, thin, and more prone to cracking. These tiny breaks may seem harmless, but they can become entry points for bacteria. Physicians emphasize that when circulation improves, more nutrients and immune cells reach the skin, strengthening its ability to defend itself and repair minor damage quickly. This is why improved blood flow is often associated with fewer infections and healthier skin texture in people managing diabetes. Nerve health is another critical piece of this puzzle. Peripheral nerves in the feet are highly sensitive to changes in blood supply. Neurologists explain that nerves require a constant flow of oxygen and nutrients to maintain their insulating layers and signal transmission. When circulation is compromised, nerves may begin to malfunction, leading to numbness, burning sensations, or loss of protective sensation. Improved circulation helps deliver what nerves need to function properly, potentially slowing the progression of neuropathy. Patients often report that with consistent movement and better blood flow, sensations become clearer and balance improves, reducing the risk of unnoticed injuries. Doctors also point out that improved circulation enhances the body's ability to detect and respond to injury. When blood flow is adequate, inflammatory signals and healing factors reach the site of a wound efficiently. White blood cells can arrive quickly to fight infection, and fibroblasts can begin repairing tissue. In contrast, poor circulation delays these responses, allowing wounds to worsen before they are even noticed. By improving blood flow through gentle exercise and daily movement, the body regains its ability to respond promptly to stress and injury, which is essential in preventing ulcers and more serious complications. There is a deeper systemic effect as well. Improved circulation reduces local inflammation in the feet and lower legs. Chronic inflammation is common in diabetes and contributes to vascular damage over time. When blood moves more freely, metabolic waste products are removed more efficiently, reducing the inflammatory burden on tissues. Many doctors describe this as cleaning the internal environment. The result is less swelling, less discomfort, and a more stable foundation for foot health. What often surprises people is how closely circulation and sensation are linked to confidence and mobility. When feet feel warmer, more responsive, and less painful, individuals are more likely to stay active. This creates a positive feedback loop. More movement leads to better circulation, which further improves tissue health and nerve function. Physicians often stress that preventing diabetic foot problems is not only about avoiding worst-case scenarios, but about preserving quality of life. Improved circulation allows people to walk with more assurance, maintain balance, and engage in daily activities without constant fear. From a clinical perspective, prevention is always easier than treatment. Once ulcers or infections develop, they can be difficult and slow to heal. Even with advanced medical care, improved circulation acts as a protective layer, reducing the likelihood that minor issues will escalate. Doctors frequently remind patients that the goal is not perfection, but consistency. Small daily actions that support blood flow can dramatically reduce long-term risks. There is also a compassionate truth that medicine increasingly acknowledges. People living with diabetes often feel blamed for complications that arise, as if they are personal failures rather than biological challenges. Focusing on circulation reframes the conversation. It shifts attention from blame to support, from control to cooperation with the body. Improving blood flow is not about forcing the body to perform, but about giving it the resources it needs to heal and protect itself. Ultimately, improved circulation supports the feet in doing what they are meant to do. It keeps the skin intact, the nerves responsive, and the tissues capable of repair. Doctors describe this as maintaining tissue viability, but on a human level, it means preserving independence, comfort, and dignity. Each increase in blood flow is a quiet investment in prevention, turning vulnerability into strength and helping the feet remain a reliable foundation for the body's journey through life. Low-intensity movement has a unique and often misunderstood relationship with blood sugar regulation, especially in people living with diabetes. Many assume that only intense exercise can influence glucose levels, but doctors and physiologists consistently observe the opposite when it comes to long-term metabolic health. Muscles are one of the largest consumers of glucose in the body, and they do not need extreme strain to begin using it. Even gentle, repeated movements send a biological signal that tells muscle cells to open their doors and accept sugar from the bloodstream. This process reduces the amount of glucose circulating in the blood and immediately eases pressure on blood vessels. From a scientific point of view, this happens because muscle contraction activates glucose transporters inside the muscle cell. Doctors often explain this in simple language by saying that movement works like a key that unlocks the cell without demanding extra insulin. For people with diabetes, whose insulin signaling may be impaired, this is profoundly important. Low-intensity exercises allow muscles to absorb glucose more efficiently, reducing blood sugar spikes and stabilizing energy levels. This improved glucose handling directly protects blood vessels, which are otherwise damaged by prolonged exposure to high sugar levels. Blood vessels are living tissues, not rigid pipes. Endocrinologists emphasize that when blood sugar remains high, it creates oxidative stress and inflammation within vessel walls. Over time, this leads to stiffness, narrowing, and reduced responsiveness. Low-intensity movement helps interrupt this process. By lowering glucose levels gradually and consistently, it reduces inflammatory stress on the vascular system. This allows blood vessels to remain more elastic, improving circulation to sensitive areas like the feet. In this way, glucose control and vascular health are inseparable, each reinforcing the other. Doctors also highlight that gentle exercise influences hormones beyond insulin. It improves the balance of stress hormones such as cortisol, which can otherwise raise blood sugar and constrict blood vessels. Calm, rhythmic movement sends a message of safety to the nervous system. This reduces unnecessary stress responses and allows blood vessels to relax rather than tighten. Improved relaxation of vessels means better blood flow, especially in the small arteries and capillaries that nourish the feet. This is why low-intensity movement often feels soothing rather than exhausting, yet still produces measurable metabolic benefits. Another key insight from medical research is that consistency matters more than intensity when it comes to insulin sensitivity. Short, frequent bouts of movement keep muscle cells metabolically active throughout the day. Doctors often advise patients that sitting for long periods is one of the greatest threats to glucose control. Even if a person exercises occasionally, gentle foot and leg movements performed regularly help prevent glucose from lingering in the bloodstream. This steady regulation protects blood vessels from repeated sugar spikes that accelerate damage. There is also a profound connection between improved glucose handling and reduced vascular stress in the feet. When blood sugar levels stabilize, the blood becomes less viscous and inflammatory markers decrease. Physicians describe this as improving the quality of blood itself. Better blood quality flows more easily through small vessels, delivering oxygen and nutrients more efficiently. This is especially critical in diabetic foot health, where microcirculation determines whether tissues remain healthy or begin to break down. Low-intensity movement also supports mitochondrial health within muscle cells. Mitochondria are responsible for energy production, and doctors explain that regular gentle activity encourages these structures to function more efficiently. Efficient mitochondria burn glucose more cleanly, producing less metabolic waste and reducing oxidative stress. This further protects blood vessels and nerves from damage. Over time, this cellular efficiency contributes to better endurance, less fatigue, and improved overall metabolic balance. What is often overlooked is the psychological impact of this kind of movement on blood sugar control. Gentle exercise is accessible, non-threatening, and sustainable. Doctors observe that patients are far more likely to maintain habits that do not cause pain or exhaustion. This adherence is critical because metabolic benefits accumulate slowly. Each small movement adds to a larger pattern of improved insulin sensitivity and vascular health. The body responds not to occasional effort, but to regular signals of use and care. Perhaps the most compassionate aspect of low-intensity movement is that it reframes diabetes management away from struggle. Instead of fighting the body with extremes, it invites cooperation. Blood sugar regulation becomes a shared effort between muscles, blood vessels, hormones, and nerves. Doctors often tell patients that this approach reduces complications not by force, but by alignment with natural physiology. In protecting blood vessels, especially those supplying the feet, gentle movement becomes both a metabolic therapy and a form of respect for the body's limits. In the end, low-intensity exercise quietly reshapes the internal environment. It lowers glucose, eases vascular stress, and supports circulation without overwhelming the system. This subtle but powerful influence is why doctors consistently recommend gentle, consistent movement as a cornerstone of diabetic foot prevention and overall metabolic health. Consistency is the thread that weaves prevention into reality, especially when it comes to diabetic foot health. The human body responds not to sporadic effort, but to repeated signals that encourage adaptation and resilience. Doctors emphasize that small daily actions, gentle stretches, ankle rotations, toe flexes, and short bouts of walking or foot exercises have profound cumulative effects on circulation, nerve health, and tissue repair. Each repetition tells the body that the feet are being cared for, that blood flow is needed, and that the systems responsible for healing can function without interruption. Over time, this consistency becomes far more protective than occasional intense activity, which may stress tissues or even create injury if the body is not prepared. From a physiological perspective, repeated movement trains the circulatory system to respond more efficiently. Capillaries, the tiny vessels that supply the skin, nerves, and connective tissues of the feet, adapt to regular stimulation by becoming more responsive. Doctors describe this as improved endothelial function, which means blood vessels dilate more easily and direct flow where it is most needed. This is crucial for people with diabetes, whose microvascular system can become sluggish or partially blocked over time. Each day of consistent exercise strengthens these microvascular networks, ensuring that oxygen and nutrients reach the tissues before damage has a chance to occur. Consistency also affects the nervous system. Peripheral nerves depend on both oxygen and metabolic substrates delivered through blood flow. Daily movement encourages the delivery of these resources, helping nerves maintain their insulating myelin and signaling capacity. Physicians often observe that patients who engage in routine foot and ankle exercises retain sensation longer and experience fewer complications from neuropathy. The nervous system learns to rely on repeated stimulation as a signal that the body is attentive, and in response, it preserves communication pathways that might otherwise degrade slowly under the stress of diabetes. There is a biomechanical component as well. Regular movement strengthens muscles, ligaments, and tendons in the lower legs and feet, supporting balance and reducing the risk of falls. Even low-intensity exercises contribute to this structural reinforcement. Doctors often point out that instability or weakness in the feet can increase pressure points, leading to blisters, calluses, or ulcers. Consistent activity ensures that weight distribution remains more even, that joints retain mobility, and that muscles actively assist in venous return. Each repetition is a small investment in both safety and tissue health. The cumulative effects of consistent exercise extend into metabolic regulation. Daily movement improves insulin sensitivity in muscle cells, allowing glucose to enter cells more efficiently. This steady improvement reduces the burden on blood vessels and decreases inflammation, which is particularly relevant for microvascular circulation in the feet. Physicians explain that the benefits of consistency are magnified over time because each session reinforces the previous adaptations, creating a biological rhythm that the body begins to anticipate and rely upon. In this way, habit becomes a mechanism of prevention as powerful as medicine itself. Consistency also reinforces psychological well-being, which is often overlooked but critically important. Patients who engage in regular, gentle foot care develop a sense of agency over their health. Doctors note that this emotional reinforcement can reduce stress and anxiety, which otherwise release hormones like cortisol that constrict blood vessels and impair circulation. Each daily session of foot movement is a quiet affirmation of care and control, an ongoing conversation between the person and their body. This psychological effect further enhances the physiological benefits of exercise by promoting relaxation and improved vascular function. Another advantage of consistency is that it allows for gradual adaptation without risk of injury. Sporadic intense exercise can strain muscles or joints, particularly in individuals with limited mobility or long-standing diabetic complications. Regular, moderate activity ensures that tissues adjust slowly, strengthening over time without excessive stress. Doctors emphasize that the body thrives on predictability, and daily movement provides a gentle yet persistent cue for adaptive processes. In the microvascular and neurological systems, repeated stimulation supports resilience rather than forcing sudden change. The concept of consistency also ties directly to prevention. Diabetic foot problems rarely arise suddenly. They develop over months or years of neglect, poor circulation, and unnoticed injuries. Daily exercises act as a protective buffer, keeping circulation active, nerves nourished, and tissues supple. Physicians often frame this as proactive care. Each small, repeated action reduces the likelihood that minor issues will escalate into ulcers, infections, or more severe complications. In this sense, consistency transforms preventive strategy from abstract advice into tangible, everyday practice. Finally, there is a philosophical dimension to this consistency. Each day spent moving the feet, however briefly, becomes an act of mindful attention. It communicates respect for the body and its intricate systems. Doctors frequently highlight that health is not merely the absence of disease, but the active engagement of the body in its own maintenance. Daily, consistent exercise allows circulation, nerves, and tissues to function at their best, and over time, this creates a foundation of resilience that supports independence, mobility, and quality of life for people living with diabetes. Caring for circulation is not only a scientific strategy, but also an act of self-compassion, particularly when we consider the vulnerability of the feet in diabetes. The feet bear the weight of our bodies every day, enduring pressure, friction, and environmental stress. Yet they often receive little conscious attention. Over time, compromised blood flow and nerve function can turn this fundamental reliance into a source of risk. Doctors remind us that prevention begins with recognition, acknowledging that the feet are active participants in overall health, rather than passive endpoints. When individuals engage in gentle, consistent foot exercises, they are communicating with their bodies in a language that is both biological and empathetic, sending signals of care, attention, and respect. Medical science reveals that each movement, however small, initiates physiological responses that protect and strengthen the feet. When muscles in the calves, ankles, and toes contract, they assist veins in returning blood to the heart. This pumping action reduces stagnation, improves oxygen delivery, and nourishes tissues at the cellular level. Doctors often emphasize that these effects are magnified in people with diabetes, whose circulation can be compromised by vascular stiffness, endothelial dysfunction, and chronic inflammation. By supporting circulation deliberately, individuals help maintain tissue viability, skin integrity, and nerve function, reducing the likelihood of ulcers, infections, or more serious complications. The connection between movement and self-compassion also extends to neurological health. Peripheral nerves rely on a constant supply of nutrients and oxygen delivered through the bloodstream. When circulation is improved, these nerves function more effectively, preserving sensation and proprioception. Patients often notice subtle changes: feet feel warmer, balance improves, and even minor discomfort diminishes. Doctors describe this as restoring communication between the nervous system and the periphery. From a reflective perspective, each exercise session becomes an intimate conversation with the body, a way of saying, "I am attentive to you, I honor you, and I will help you thrive." Blood sugar regulation is intimately tied to this process, reinforcing the idea that caring for circulation is both a scientific and compassionate act. Gentle, regular movement enhances insulin sensitivity in muscle tissue, facilitating the uptake of glucose and reducing blood sugar levels. This reduction alleviates stress on blood vessels, diminishes inflammation, and lowers the risk of microvascular complications. Physicians note that low-intensity, consistent activity can be more beneficial than sporadic, high-intensity exercise because it sustains metabolic balance without triggering stress responses. Each repetition is a quiet investment in long-term vascular and neural health, a preventative measure that grows in strength through consistency. Emotion and psychology also play a role in this act of care. Living with diabetes often involves anxiety about potential complications, especially in the feet, which are susceptible to unnoticed injuries and slow healing. Gentle exercises transform this fear into proactive engagement. When individuals take the time to move, flex, and stretch their feet deliberately, they gain a sense of control over their health outcomes. Doctors recognize that this psychological reinforcement is not merely comforting, it has tangible physiological benefits. Reduced stress lowers cortisol levels, which in turn allows blood vessels to dilate and circulation to improve. The interplay between mind and body illustrates that caring for circulation is as much an emotional practice as it is a biological one. The philosophy of prevention through compassionate movement aligns with the idea that the body thrives on repetition and attention. Microvascular adaptations, improved nerve signaling, and enhanced metabolic efficiency all require consistent stimuli. Daily foot exercises, performed mindfully and gently, create the conditions for these adaptations to occur. Over time, the benefits accumulate quietly, often unnoticed until the body demonstrates increased resilience through warmth, sensation, and mobility. Physicians frequently remind patients that the most effective interventions are subtle, sustainable, and continuous rather than dramatic or infrequent. Biomechanical integrity is another dimension of this self-compassionate care. Muscles, ligaments, and tendons in the lower legs and feet respond to regular movement by strengthening, improving balance, and distributing pressure more evenly across the foot. Doctors often point out that uneven pressure or instability can create hotspots where skin breakdown occurs, leading to calluses, blisters, or ulcers. By nurturing the musculoskeletal system through gentle, repeated activity, individuals help their feet maintain structural resilience. Each controlled movement becomes a way to prevent injury, maintain function, and support independence in everyday life. There is also a reflective aspect in observing the body's responses. As circulation improves, patients often notice warmer skin, reduced swelling, and enhanced mobility. This is evidence that the body is responding to care, validating the time and attention invested in these exercises. Physicians underscore that this feedback loop, where action leads to observable improvement, reinforces adherence, turning habit into a lifelong commitment to health. Self-compassion and scientific strategy intersect here, demonstrating that prevention is not only a medical goal, but also an expression of respect for the body's complexity. Caring for circulation through daily exercises embodies a holistic approach to diabetic foot health. It addresses vascular function, nerve integrity, metabolic balance, musculoskeletal support, and psychological well-being simultaneously. Doctors often stress that no single intervention works in isolation, but together, these elements create a resilient system capable of withstanding the challenges posed by diabetes. The act of moving the feet, paying attention to sensations, and engaging muscles gently is therefore a multi-layered practice: physiological, psychological, and philosophical. Ultimately, the practice of supporting circulation in the feet transforms the ordinary into the extraordinary. What might seem like simple movement becomes a profound act of communication with the body. Each exercise sends oxygen, nutrients, and healing signals to tissues that are often forgotten, reinforcing the delicate balance between vulnerability and resilience. Doctors recognize that prevention begins with consistency, attention, and respect, and that these qualities can be cultivated through mindful action. The quiet rhythm of daily foot exercises not only enhances circulation, but also nurtures a relationship between the individual and their body that embodies both science and compassion.